Hello, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I've partnered with them to bring you an easy and educational workday session. I'm a physical therapist. I have a doctorate in physical therapy. I'm the owner of PAR5 Physical Therapy here in Randolph, New Jersey, and I've been in the PT field for over 25 years. I specialize in orthopedics and golf fitness. So today, our session is going to be, how does a massage gun work? So I know there's a whole bunch of brands, different things. You see them everywhere. They've been ubiquitous in the past couple years. It used to be only had like one or two brands, but there's so many out there. What do you choose? How do you choose it? And how do you use it? I've had a lot of clients come up to me and say, yeah, I've got this massage gun, but I'm afraid to use it, especially if I have pain, because I feel like I'm going to hurt myself. So we're going to cover all of that today. Let's get into, pull my slides up here. All right, so how does a massage gun work? Now, because I'm a physical therapist, I have to give you this disclaimer that all of this information that we're going to be going over today is useful, it's helpful, but it is aimed at a broad population. So if you're dealing with something specific issue or specific problem, please consult a medical professional, because so that you can have a thorough physical evaluation and have all the related factors and causes, root causes addressed and get to your goal. Now, if you've been to any of my talks before, this next slide is going to be familiar, because if you come to any of my talks, any of my classes, and you remember one thing, remember this, that the body functions on an alternating pattern of stability and mobility. If that pattern is disrupted, then pain or injury is usually the result. So here's that video and the slide up again. The body functions on this alternating pattern of stability and mobility. If that pattern is disrupted, then pain or injury is the result. So usually if somebody comes into me and says, hey, I have back pain, can you treat my back? I've been to many other physical therapists, and this has been going on for more than 5 years. I think about it, going to have surgery or whatever. And they've gone through multiple bouts and rounds of physical therapy, and they've always treated their back. It felt good, but the pain or dysfunction or whatever came back. That's because of this alternating pattern theory here, is that usually the back is supposed to be a stable segment. And if the segments above or below, say like thoracic spine, the T-spine, or the hips are not mobile, because they're designed to be that way, they're not mobile, you've lost range of motion in your thoracic spine or your pelvis or your hips, then the lower back turns into a mobile segment. It turns into an unstable segment. So then that's the root cause of why your back hurts. Another way that I look at it, another saying that I usually use is, let me make sure I get this right. Victims will scream, but the thieves, the crooks, will stay silent. All right. So that means that, wherever you have pain, whatever, make sure that you're addressing the root cause, because it might be something that's insidious that you're not paying attention to, like your back or your thoracic spine or your hips, and the reason why your back hurts. All right. So there's a lot of massage guns out there, so many different brands now. The last time I checked, I started out using, a regular massage gun from like Walgreens. You could pick them up at Walgreens. You could pick one up at Costco. They both basically have all the same type of features, but we're going to dive into what makes one better than the other. So if you think about, basically you have this head that's on the gun. It vibrates, it oscillates. And that's what's supposed to be the therapeutic effect. We'll talk about how exactly that works in a second. Most of the machines they're run by battery. They have settings which increase the intensity or decrease the intensity. And typically that setting increases or decreases the frequency, how fast that head is vibrating. Lower speed versus higher speed, but it doesn't change the oscillation. We'll talk about that. All right, let me see what's going on with my slides here. Everything's kind of messed up. Oh, look at that. It's a video. It's a video of what the massage gun looks like under slow motion. Look at that. Got to put that in. It's basically creating these waves, that percussive force through the tissue. All right. So what I want to go over next is oscillation depth. So the oscillation depth varies by brand. So if we have a gun that makes that has a head that travels up and down, most store-bought bands, like say the ones at Costco, the ones that are very cheap, they're like probably $99. Their oscillation typically ranges around 10 to 12 millimeters of travel. All right, then there's the Hypervolt, which is made by Hyperice. We're going to show you that in a second. That brand has been around for a while. Their oscillation depth is usually around 12 to 14. I believe it's 12 millimeters. And then there's a Theragun, which is manufactured by a company called Therabody. They recently changed their name in the past couple of years. Their brand oscillates at 16 millimeters of depth. Now, what does that matter? So pain it is basically an electrical signal that comes from a certain body part and goes to your brain. And your brain has to interpret that electrical signal. All right, that nerve that sends that signal to the brain is relatively slow when it comes to the body's nerve types and how fast they could send that electrical signal. You can drown out or reduce the sensitivity of that pain signal by using another nerve. The nerves that transmit vibration or light touch, right? Those, or deep touch, that's another one, or deep pressure, those travel a different nerve pathway, and they actually travel faster to your brain. So just like if you were in a crowded room, or it's summertime, it's a little bit rainy in New Jersey, but in the summertime, if you're at the beach and everybody's got their radios playing, you could only hear the loudest conversation in the room, the loudest speaker, or the loudest radio on the beach. The same thing goes with your brain. So it can only pay attention to the loudest signal. So if we get a vibration or percussion signal going to the brain quicker, it can block the slower nerve signal, pain nerve signal to the brain, and that's what reduces the pain intensity, the pain sensitivity, and that's how that works. So not only does the massage gun work on a musculoskeletal, or basically the meat of the body, but it also affects the neurological. So there's two systems of the body that are involved. It reduces tone from a neurological standpoint. It reduces the tightness or the amount of the tone that the muscle is on, and enables it to relax. And then depending upon the direction or the way that you're using the gun, you could also reduce tissue adhesion. So muscles are housed in this connective tissue fascia, right? And this fascia connects everything, kind of fills in the gaps. It's like a sweater-like material, right? Muscle without fascia is just basically hamburger meat. It's deformed, right? So, but basically our body and these muscles that sit next to each other, above or on top of another, they need to slide and move. And that little connectivity between the two, that fascia that sits there, we need to be able to create more sliding capability of that. So any adhesions between those tissue layers, you can kind of reduce that with the massage gun. And then also we touched on pain sensitivity. All right, we do reduce the pain sensitivity by increasing the sensitivity or the sensation of vibration or percussion. Now, treatment time. How long are you using these guns? So pre-activity, if you're going to go work out or run or do some type of sport, and you want to use the gun as a warm-up to increase blood flow to an area or wake up the nervous system, then we would go at a higher intensity and quicker application and a shorter amount of time per body part. I would say 30 seconds, if that, per body part, per muscle, right? So sweeping fast. If we're doing post-activity or recovery or pain relief, we want to set the intensity of the gun at its lowest intensity and go slowly over the area and work on at least 1.5 minutes to 2 minutes per body part. All right. So if you have any questions, feel free to put them in the chat here. I am going to pull up my 2-shot here. We're going to talk about these brands here. So this right here is the Hypervolt. It's this is a Hypervolt Plus. They have different brands. Basically, Hypervolt or Hyper Ice makes different levels of their gun, just to give you features. It has like a rechargeable battery here and different heads. I got the heads in the bag here. This is the standard round head. They have softer ones. They have pointier ones. This has a switch at the bottom, turns it on, and then you have a button in the back. It has 3 levels, and you could probably hear, maybe you might not be able to hear that, but relatively that is one of the quieter ones. Now the massage guns, like I said earlier, that have a more shallow percussion oscillation, they're usually quiet. And I don't know if you could see this on the camera here, that oscillation there is, that's a 12 millimeters, all right? So that's the lowest setting, and then it goes to medium, and then it goes to high, and it's just going faster. That's increasing the frequency that this gun is working at. Okay, so I'm going to turn that off. That cycles through all the way off. And then we have the Theragun here. The Theragun, again, has a 16 millimeter oscillation here. I'm going to turn this on, and because it is a beefier machine, it is somewhat louder, but it's not that bad. There's a lot of newer models of these. This is kind of like a 2-year-old one. I've been using these. And again, Therabody is the company that makes this. This is the Theragun model, the Theragun Pro. It has a lot of different features, additional features that you might not even use. But again, this is the largest head on here. And let me put this up close to the camera. You could see that that oscillation is 16 millimeters here. All right. So why do I have 2? I have 2 because a lot of people that come to see me may be more sensitive, have more pain than they could tolerate the deeper penetration of the Theragun. So I usually use the Hypervolt. Again, our first step when we're usually using the massage gun is recovery, reducing tightness in a muscle, reducing pain. So for example, I'm just going to get onto my thigh here. Let's just say my knee is hurting me. I want to address everything that's connected to the knee above and below. So what I would start with is the weight. You know, how much pressure are we using? Just use the weight of the gun. All right. So it has some weight to it. You don't need to press down. Just let the machine do its work. So we're going to go slow. And you think about this muscle, my quadricep goes all the way up to my hip. And I'm going to stay on here, and I'm going to try and sweep slowly, and I'm going to go for 2 minutes. And typically what you would do is, yeah, you would feel some parts that might feel more sensitive or more dense than others. Those are the spots that you're going to spend the majority of your 1.5 to 2 minutes on. We want to be able to reduce that. And oftentimes it will be uncomfortable. It will feel like, oh, I got to stop that. I can't tolerate that. That's fine. You can lighten up with the pressure, but you want to try and stay on there for as long as that 1.5 to 2 minutes. And one way to reduce that sensitivity to that area is to work on some deep breathing techniques. Inhaling and exhaling through the nose, right? Maybe 2 seconds in, 4 seconds out. A longer exhale will reduce the sensitivity, reduce the pain, reduce that level of threat that your nervous system undergoes when we do something like this, and make it less painful, less uncomfortable. But the more often you do this, the more tolerant your body tissue becomes, right? So it becomes less and less painful. You can do this. One other question that I get often asked is, what happens if I go on the bone? So if I'm going on here, it works on the meaty parts of the body. So we have muscle, tendons, all the big muscles here. I could do the hamstring and the IT band on the side here, maybe get a little bit of the calf and the anterior tibialis muscle down here in my shin. If I go on the bone, it's just going to give me a lot of feedback. It's not going to damage anything. I'm not going to break any of the bones, but it's just going to give me a lot of feedback and a lot of vibration. And you know that if it's really sharp, when you go on the bone, you don't want to do that. So it's kind of like a self-limiting treatment that you go where you can tolerate it. The intensity of the, I guess, this comfort level should never be above a, 4 out of a 10, and it should never be sharp. And afterwards, when we get done, it should not feel any worse. So going over bone is okay. It's just going to give you a lot of bounce back, a lot of feedback. It's not going to be comfortable, but you're not going to hurt anything. So, especially if I'm going to go on my back here, I could take my Theragun here. I like this triangle handle because it makes it easier for me to kind of get onto the back, lower back, and my glute in this area. So as I'm doing this, again, I'm just going through the meaty part in my glute and my hip. I can see, kind of feel where the bone is, and it kind of gives me more feedback where it's stiff and hard, and I'm not going to spend that much time on there. Again, it's going to be a minute and a half on meaty spots. So let's just say, for example, if I'm going to do something with a warm-up, then we're going to take the gun and we're going to move faster at a higher setting. So this, we were doing this at the low setting. I was doing slowly, and I'm going to crank this up now. This is the highest setting, level 3, and I'm just going to go back and forth really quick here. This wakes up the nervous system, primes the muscle for activity, and I would just sweep maybe 30 seconds each body part here. Not a lot of pressure, just light and quick. It's more of a neurological effect than a musculoskeletal effect. Alrighty. So, and also we have each of these brands and each of the other companies make different attachments for different parts. Often, most of them do have like a softer attachment, right? So you can kind of go over more sensitive areas. Theragun even has like this one that's super soft. I'll show you this one really close. It's like a little sponge, right? So that sponge is really good for around bony areas, and it's not as it's their way of trying to temper that 16 millimeters of oscillation with the sponge. I've seen this type of attachment with the dual prongs here. Let me see if I can put this here. So yeah, as you can see the dual prongs, this is from the Hypervolt. You could do this right down the spine, right down the back with the prongs on either side, or you can go through different muscles. I mean, with the smaller attachment, the decreased surface area that's touching the body, like for example, this pointy one, it's super small, and the smaller attachment point is going to target it's going to feel more intense, and it's going to target those little adhesion points if you feel like you have them. Alrighty, so those are the two brands that I use. I like using them because of the amount of oscillation that I get in the 12 millimeter and the 16 millimeter with these two brands. Most of the other brands that I've used that you can get on Amazon or Costco or any other type of drugstore, they're usually about 10. And they are very, in terms of very comfortable, in that they don't penetrate that much. It's more vibration. And because it is more vibration, it's less of a tissue adhesion breaking up mechanical type of force, less percussion, and more vibration, which will address pain and decrease pain sensitivity. All right. And the other thing I would say is when we are doing something like this on our body, we want to try and work through the full length of that tissue. For example, for the muscle here, I was doing this in a seated position, but it's useful also to even try and stretch out and work on it in a stretched position, which will help alleviate or reduce some of those adhesions between different fiber layers. All righty, so let me check the chat here and see if we have any questions. So there's one question here in the chat here. What about the Theragun Mini and the head on it? Well, the Theragun Mini is very similar to the Theragun itself. The only difference is that it's a lot smaller. You could, it's more portable. They have the standard head, which is the rounded one. They have, let's see here, where do I got it here? There's the standard head right here. So this is the standard head that comes off of the Mini, and then I think that they do have the softer one. This is their softer version. Again, I would say it's personal preference. I have the larger ones and all the way down to the small ones, so we could vary the size of the contact point and the intensity depending upon the body part or the application area, right? So that's the only thing. That's the only difference between the two. All right. Yeah, so you can totally go online to therabody.com. They all sell, all these different brands sell them separately. You can buy them. I mean, the other one that I bought second is a Theragun. They actually attach is two heads to one, so you can kind of vary and then kind of cover a lot more surface area with the two heads. So, you know, different brands make different attachments. Alrighty, so I hope that answered all your questions. Let me know if you have any other ones. I'm just going to take a quick peek here in our chat. And it looks like no other questions. I'm going to give it the yes. Oh, another question is it safe to do daily? Yes, all of this is safe to do daily. It is, you know, it's non-narcotic. It's not a medication that you can overdose on. I will say this though, is that if you do it and you exceed that 2-minute time period, especially if you're going to do it for pain, and you're going and it feels so good, you're doing it for more than 2 minutes, the only side effect that you might get is just a little bit of soreness in the area. So that means that you just overdid it. That's the only downside that I've seen with a lot of clients that have overdone it with their guns at home. And you know, it's the only danger of, yeah, so it's pretty safe. And the other thing too is with both of these brands, the Hypervolt and the Theragun, they come with a smartphone app. And if you download the smartphone app, it connects directly via Bluetooth to the gun itself, the massage gun. And I think Theragun definitely does it. I don't know about the HyperIce version, but it can control the intensity and the time if you just input why you're using it, what body part it is. You just click that and it turns on the gun and it says, and it shows you on a video what to do and how to do it. So with these brands, just look to see if they have a smartphone app. If they do, usually that'll connect to the Bluetooth. I think the Theragun Mini, I'm not sure. It has to have a Bluetooth connection. If it does connect Bluetooth wise, then it'll work with the Therabody app. Alrighty. Great questions today. I hope that this session was helpful and informative for everybody. I know that, you know, I love my I have like 2 more at home. I use them all the time. The more active you are, or the more stress you put your body under, the more you should have some type of system to help you recover and de-stress and maintain your body so that you're ready to go at it the next day. Alrighty? All right, so thank you everyone for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps.